Hey everybody, today we're going to talk about blood pressure. Kind of like our video on asthma last time, this one's more about dealing with an issue through exercise. So even though blood pressure can be very effectively controlled through medication, what we're going to talk about today is a little bit different approach. See, the way we viewed blood pressure in the past is that hypertension, which is elevated blood pressure, is a disease itself that can be easily treated with medication. And in a way, this is true. See, when our pressure is too high in our cardiovascular system, one of the first responses is often what's called a diuretic. This decreases the amount of fluid in your body, which allows a decrease in the blood pressure. Now, because high elevated blood pressure can increase the risk of things like aneurysm, stroke, and different issues that are very similar, it's one of our first and most important things that we can do is just get a direct decrease. However, what we've discovered lately throughout our medical studies is that that's not always necessarily the only thing that we need to be approaching. You see, your blood pressure is tied very closely to the overall health of your cardiovascular system. Sometimes it's not only a disease, it's a symptom of greater problems. So, one of the things that we tend to encourage in physical therapy is not only controlling your blood pressure well with medication, but working on decreasing your need for that medication. It's kind of similar to addressing a muscular injury. So if I were to injure my hamstring, whether I'm playing a sport, running, or just using it too much in daily life, if all I do is treat it by taking pain medication that controls how much of the symptom I feel, I could continue to overuse it, continue to injure it worse, and eventually lose entire function of that hamstring because I've done too much damage to it. Our cardiovascular system kind of works in the same way. If hypertension is telling us that there's something wrong with this system, we need to work on improving the efficiency of that system, improving its health, so that eventually it doesn't give out on us too, or cause other problems down the line. So, just because it's powered by a muscle, it means we can treat it very similarly to the other muscles of our body. Our heart is the, of course, most important muscle in our body, and challenging it can be very important, because like every other muscle, if you don't use it, you'll lose it, and that can be a huge risk for all of us. So, when we talk about different exercises that challenge your cardiovascular system, we actually get relatively specific here. Because, like when we challenge muscles, we want to feel it a little bit at the end, which means you're going to have an increased respiration rate, you're going to have a much higher heart rate. Very often you're going to break a sweat. And this can be relatively uncomfortable. And sometimes it can be something that worries people a little bit. So it's often a little bit more comfortable to do it under the supervision of a medical professional, or at least somebody who specializes in this kind of thing. Very often personal trainers, physical therapists, and cardiovascular therapists are a great first line of people to ask of whether or not it's safe to do the type of exercise you're doing, and at what dosage you should be doing it. And what that means is how often, what intensity, how long, and what kind of exercise might be helpful. Because very often what I find in my office is that people come in and say they've been exercising, and we talk about the exercises they've been doing, and it doesn't address their direct issue. We always want to make sure that that's exactly what we're doing, especially when we're targeting the system as directly as what we're doing here. Now the great news is, if we challenge your cardiovascular system, like every other muscle in your body, it can improve, and it can keep moving forward. As that health and efficiency improves, we often see people decrease their need to use medication, or sometimes they can even entirely eliminate it. The reason that's important is not just because we're now treating the cause and not just the symptom, but very often medication comes with other side effects that can affect how you feel throughout your daily life or other risks throughout your life. While we always want to address blood pressure because that risk is higher than almost any that come with the side effects, we want to make sure that if we can control it without, we're doing exactly that, because that overall health can be very important. Polypharmacy, which is a prescription of a lot of medications, actually comes with its own risk factors. So the more you can do to decrease your dependence on any certain medication, the more healthy you're going to find you feel and throughout your daily life, and the less risk you're going to have for other things. If you have any questions about specifically how you can address your blood pressure with different types of cardiovascular exercise, this varies greatly throughout different ages, different body types, and what exactly challenges you. So I'd recommend contacting a healthcare professional who specializes in this kind of thing. Obviously, like I said, physical therapists, personal trainers, and cardiovascular therapists are a great first line. However, your cardiologist and your primary care physician can also probably provide you a little bit of help, or at least a little bit of direction of where you can go in your area to make sure you're asking the right questions. Of course, if you have any others you'd like to ask me directly, you can always contact us at Home and Rehab, and we look forward to hearing from you. Have a great day, guys.